Almost each and every one of us who experience hair fall might be wondering why it is happening with me. So here in this video, I'll try to explain what could be the underlying cause that is responsible for the excessive hair loss. The first one is family history or the hereditary factors. So this is the most common cause of hair fall in case of males, where the person's family will be having a history of baldness. And there is a hormone called as DHT or dihydrotestosterone, which will make the follicles thin, and over a period of 5, 10 or 15 years, the follicles will gradually start becoming thin and finally it vanishes from that place. The second one is hormonal factors. Usually females experience this kind of hormonal related baldness, and the hormonal changes could be due to thyroid issues, it could be due to polycystic ovarian disease and congenital adrenal hyperplasia. The first two causes, what I told, most of you guys might be having this issue like a thyroid problem or a PCOD. The reason why we dermatologists ask you to get these tests done is until we not control this underlying cause, the problem of hair fall is going to continue. So always get the blood test done when your doctor recommends for the same. The third one is alopecia areata. Like this is a kind of autoimmune condition where the follicle will be damaged, attacked by the immune cells, and it causes a circular patch. The fourth one is telogen effluvium. Telogen effluvium is a condition where excessive shedding or thinning of the scalp hair will be happening, and there are numerous causes for it. So usually it is a febrile illness like tuberculosis, typhoid and malaria. After pregnancy, during lactation, when there is some organ dysfunctions like renal failure or hepatic failure, when in sort of malignancies like lymphomas, leukemias, mental stress, emotional disorders, lack of sleep, depression, the list goes on and on and on. The next one is scalp infections. A clean and healthy scalp which is free of infection suggests a good quality hair. So usually bacterial infections, that is folliculitis, a fungal infection, severe fungal infection like a dandruff issue, or even tinea infections, that is ringworm infections on the scalp, can lead to baldness or excessive loss of hair. And the next one is drugs or medications. A lot of medicines like statins, which are your blood thinners, antihypertensive medications, aspirins, anti-thyroid medications, oral contraceptive pills, and chemotherapeutic agents, that the medications which are given to treat the cancers. These are also cause for hair fall. Next is scarring alopecia. Scarring alopecia means there is a scar on the scalp, and it could be due to any sort of injuries, traumas, burns, or any inflammatory conditions like severe infections of the scalp that can lead to a scarring alopecia. Next is nutritional deficiency. Crash dieting, very common that is happening these days. Crash dieting and a rapid weight loss. These people usually start experiencing too much of hair fall 3 months after they start this. So always remember that could be a reason for excessive hair loss. Calorie and protein deprivation, then chronic iron deficiency, zinc deficiency, vitamin deficiencies. These are few nutritional causes. The last one is the environmental factor. This is very important. The reason is smoking, pollution, physical and mental stress, repeated and prolonged use of hair care products like dyes and styling gels, repeated hair straightening using that ironing thing and all. These are very much causes for excessive hair fall. A person will be having a family history or a genetic tendency to lose hair. When these kind of environmental factors get added on, it definitely triggers the thing, and the process of this hair fall will get accelerated. So don't neglect if you are if you are experiencing any of these underlying conditions, and if you have a severe hair loss. Ignorance can turn out to be expensive, which means hair transplantation is not always the solution. Maybe if we treat the underlying causes, we might avoid that as well. Try to evaluate the numerous causes as mentioned from your dermatologist, and then take the suggestion. Thank you.